caffeine, of course, is addicted. Take somebody who drinks a lot of coffee and tell them not to drink any, they're going to have a few days of headaches and
lies. That's all lies. I'm telling you, lies.
I want to talk about one of Heath's comments too, which speaks to this, and that is that people believe that if something was legal, then it's free of adverse effects, and that is just not true. That was part of the belief up here in Canada that people were saying once it was legalized is, well, it's safe. I mean, the government's legalized it, so it's not harmful, and or saying, well, it's not nearly as harmful as alcohol. And the reality, they're both harmful, just in different ways. But they both have meaningful levels of harm to them. So
I will exclude Red Bull and fresh brewed coffee from that list of what you talked about. I will exclude those two things from that list.
I was going to say, you've seen me pick out, if I had to eliminate coffee, in fact, my wife would be the one who would say it. Well, I'll get up sometimes at 2 a.m. and go get a cup of coffee, and then I'll go back to bed.
I am not a doctor, but you officially have a problem, Dr. John. I just want to let you know that if you're getting up at 2 a.m. and you're grinding
to have coffee, I'm getting up because of my age, probably to use a restroom.
Okay, that's fine.
Then I think, oh, coffee would be nice. Like, just it smells nice. It's warm, especially if it's a cold night here. See, it's cold here in Canada. I should have that as an excuse that I need to warm up.
You might have to check yourself in and hire Dr. Heath for some services. Here's a question, and I won't put on my ministry hat just yet, but why do you think, in general, why are we so addicted to, whether it's a substance or everything we talked about? Why is that? Why are we so addictive in nature as human beings?
See, and this is where I would say you could put your ministry hat on, because
I'm going to, trust me, but I'll let you go first.
I think part of it is a spiritual void. When we have that void, we look to fill it with something, and substances make us feel good. They're temporary, but they do make us feel good, and so people have, for again, the long term, done that, reached out as a way to fill that void. And so, I mean, there are clearly other factors that go into substance use disorders. But to me, again, if you're going to be an expert in this area, you better understand the biopsychosocial and spiritual factors that contribute to not only how this disorder develops, but how you treat it. Because if you don't treat all the silos that contributed to that disorder developing, you're going to leave someone in a position of relapse. That person is still going to have that void. It would be akin to treating somebody for a substance use disorder and ignoring their maybe their co-occurrent major depressive disorder and thinking they're just going to be okay. Well, no, they're not. The major depressive disorder is going to lead back to using substances and that cycle. And similarly, if you ignore the spiritual silo, you're going to do the same thing.
Like I reiterate, I am not a doctor. From a ministry perspective, I do believe that there is one silo, if not addressed properly, it doesn't matter how many silos you address, you will continue to fail. And that's a spiritual one. And I'm not taking away from obviously what you do as what you do, but I do believe that, because there is such a heaviness, a spiritual heaviness, and we don't talk about this enough as clinicians, as pastors, that the spiritual heaviness of someone that is addicted to a substance, the substance is not necessarily the issue in itself. It is the fact that you talked about, you said there's a void that we need to fill, and it feels good, but only for a season.
Yep.
And left unaddressed, and I don't have all the clinical terminology, but what I do know is that if there's an addictive nature or something that happened that you have not dealt with in the spiritual realm, there's a backdoor or a legal right that the enemy has, Satan, for those that are in the Christian space, he has a legal right to continue to torment you spiritually in that respect. We can call it temptation, we can call it addictive, codependencies, we can call it all different languages. But in the spiritual side of it, if we don't take away that legal right that he has to continue to pester us and harass us in the spiritual aspect of it, that's where a lot of that struggle comes from.
And it's not just, as you would well know too, substances, because what ends up, that's where sex addiction lives, that's where gambling lives, that's where shopping addiction lives. That's like the space that is filled by is detrimental, is what it is. It's just, what is it that's going to position itself there? And again, similar to what you just said, unless that's addressed, it will just continue to stay there. It's not going to kick itself out.